Health experts are warning people to be aware of bird flu. Louisiana had not only the first human case in the country, but also the first bird flu death. I spoke with experts about the risk and what you should be aware of as the disease spreads. According to the Louisiana Department of Health, the first person in the United States to develop a severe case of bird flu has died, making Louisiana the only state in the country to have recorded a human fatality from the disease.
The data that we've been seeing is that there are concerns about mutations when they get into humans. And so this Louisiana case in particular, they noted a mutation in the virus that made it potentially more transmissible and or more virulent. The good news was that it did not pass to anyone else.
The individual, who was over 65 and reportedly had underlying medical conditions, was hospitalized with the flu after exposure to a backyard flock and wild birds. Some experts believe those pre-existing medical issues could have played a role in the patient's inability to recover from the disease. However, industry professionals like Dr. Rebecca Christopherson argue that there is insufficient evidence to support that.
In humans we have seen have been severe. So both of the severe cases did have underlying conditions, but we don't have enough cases to really say that those underlying conditions really are the risk factors.
Now, while the disease did not pass on to anyone else that experts are aware of, we are still not in the clear.
The worry, of course, is that the longer it stays in mammal populations, the more it might pick up some of these mutations that makes it better at being more mammal, less bird flu. And then we get into a situation where it's more transmissible or possibly even more virulent as well, and then you're going to get more of these severe cases.
So how do we combat this disease and keep ourselves, our domestic animals, and our family safe? Dr. Mark Mitchell, veterinarian and professor of zoological medicine at LSU, says the answer is simple: remain vigilant.
There are great ways for us to stay ahead of this so we don't end up with a pandemic. If you've ever been around a bunch of young age kids, kindergarten, preschool, the parents all know the kids go to school, bring back the disease, wipe us out. Those bird feeders for wild birds, some wild birds bring that disease in, make the other birds sick, and it's not just avian influenza. There can be salmonella, mycoplasma. There's lots of diseases we worry about. If you see sick or dying dead birds, make sure that you're wearing appropriate protective gear, gloves, a mask, same kind of mask that you wore during the last pandemic. Contact an expert, a veterinarian, Department of Agriculture for your poultry, wildlife fisheries for wild birds, and have those partners help you to manage those cases.
In the meantime, both Dr. Mitchell and Dr. Christopherson are working to keep Louisiana residents safe and free of bird flu.
We're not trying to fearmonger. We're trying to make sure that we keep the message out there that this thing is happening. But we want people to understand that we are doing what we can.